the Local Dental Nurses with your hosts, Kate and Shelly.
Could hear a pin drop.
Oh, I can hear you. There we go.
How are you doing, Shelly?
I'm very well, thank you. How are you?
Yes, I'm good, thank you, Dom. I'm good. I can't believe another week's gone by. Where's that gone, right?
I know. And March as well now, into a nice new month.
I know. Bit of a cheeky pancake day thrown into the week as well.
Yes, that was nice. That fell on hubby's birthday, so it was birthday cake when they came in from school, and then pancakes for tea, so everybody went to bed high as a kite.
High as a kite, absolutely. Yeah. Well, then, what do you have on your pancakes?
For me, it's classic. It's lemon and sugar.
Loads of people are saying that. Loads of people. Do you know what somebody said on the radio? Tomato sauce.
No.
Tomato sauce, but
that's not right. That's not right at all, is it?
This could be a whole different podcast about
this.
Food.
We could do podcasts about food because it's my favourite subject. I could talk for hours.
Look what we're like when
we're in surgery together, and it's like, I had some lamb the weekend, and I'm going to have this later. We're all stood round at 10 in the morning, tummies rumbling.
Absolutely brilliant. Well, we're back again. Another Nurses podcast. They're going down a storm, so we're just going to try and entice people to come and not be shy and come and join us. But I think you and I want to have a little chat about the nurses' role and actually what we like within the nursing role, aren't we?
Yeah, so just sort of take it back to basics a bit. I think it's all been a bit full on with COVID and all that sort of stuff over the last couple of months. So just take it back, just strip it bare now. Take it back to why we got into the role and what we enjoy about it.
100%. And why what keeps us going back to this role, and as you said, during the last 2 years, it's certainly been a trying time for a lot of people within the dental field, certainly not just nurses, but we're going to concentrate on nurses. So as a nurse, I mean, what was or what is your favorite treatment? When you look at that day list the day before or in the morning, what gets you going when you look at that day list and think, oh yes?
Well, it's changed so much over the years. As you know, implants now, over the last sort of couple of years, they've really taken off in our practice. Me and Debbie, our implant coordinator, nursed on Monday with Jag to do an implant. That's really enjoyable. I always enjoy those. I like crown preps.
Oh, okay.
I do like a crown prep. It depends who I'm nursing with, because some are quicker than others. I like treatment, to be fair, because I just find it takes up a bulk of the day rather than if you've got checkups in all day.
Oh, yeah. Back to back.
It's just draining, isn't it? It's the conversation, the same conversations over and over again. It's turning the instruments around a lot faster. I like treatments.
Yes. Yeah, I must admit.
Maybe not root treatment. That's...
I did quite enjoy that, but then again, it all depends which tooth. So, if you were talking like a moldy tooth and you can see the dentist getting a little bit stressed, that was probably not as enjoyable as it would have been if it was, an anterior tooth. But I think when I was actually in general dentistry, because obviously now implants, without a doubt, I've always loved surgery. So, unfortunately for the patients, when the dentist would say, well, think that's actually going to be a surgical extraction, inside, is it wrong that I was like, yes.
You love the blood and gore.
Yeah, always have. And an apicectomy, my goodness, it was like having 2 birthdays on one day.
I've never done an apicectomy. Never, ever, ever.
Yeah, used to love them. But yeah, I think with you, actually, I mean, I did enjoy the new patients with examinations, but I just think when they were back to back, it was a long session. Yes. If you had a morning of checkups or an afternoon of checkups, that was you know, that made the session long. But yeah, so I'm with you really with treatments. Yeah, I do love treatments. Fill-ins, I used to love fill-ins. And again, do you know what? You are right with what you say. It depends who you work with as well. Much like yourself, you know, I've worked with some fantastic clinicians and they all approach things very differently. And, you know, some people would do a fill-in like it was a piece of art.
Oh, yeah.
You know?
Yeah.
And that's really lovely to see. And, you know, others are just a bit more speedy, you know, and get the job done satisfactorily, but just not, you know, with that kind of art.
Finesse. Yes. Yes. Yeah. I know exactly what you mean. I've seen people carve amalgams, cusps onto amalgams for 20 minutes. Like, why? It's silver. Just, what are you doing?
Well, it's better than putting the thumb.
It's lunchtime. Well, yes, I've worked with a few of those as well. Yes, indeed.
Lunchtime. Do you know what? That's another thing as well. I think that's quite a big bugbear with some of the support staff and dental nurses is their lunch times as well. You know, they're very protective over it, but you know, rightly or wrongly, I've got no particularly you know, strong views on that. I think it's whatever works for the individual. But then, you know, we work with some of the teams that are quite happy to, you know, go into lunch if it is just to, you know, help that patient for 10 minutes or so. It's a difficult one, really, I think.
Yeah, it's at our place, the boss is quite strict about lunch times, and he will quite often, if one of the clinicians runs late unnecessarily because they're yakking away, or yeah, he is quite strict when it comes. He likes everybody to have their full hour. Again, yeah, like you say, it can't be helped. You know, sometimes you might go to do an extraction, it turns into a surgical. I mean, there's no way you would sort of down tools and say, well, sorry, it's 1 o'clock. You know, I've got a butty and a cup of tea waiting upstairs. No, you know, nobody in their right mind. You know,
tempting.
Very tempting, very tempting. But we all know there's times when it, you know, it just can't be helped. But yeah, they're quite strict at our place that everybody is to get their full hour, and you do what you can. Yeah, you know, you've got to sort of, just do what you can to ensure that you are finishing on time. And but then sometimes it's tricky because they're sort of leaving surgery at, say, 1 o'clock. But then it's the people downstairs, you know, if they've got to take payment and then faff around with booking various appointments. So sometimes on the desk they can finish a bit later, but it's part of the course, isn't it?
Do you know what it is? And I think, you know, on the whole, my experience with the practices that we're in, you know, it's a bit of give and take.
Absolutely.
So, you know, you've worked into your lunch a quarter of an hour. If there's the opportunity that you leave quarter of an hour earlier, then, you know, we see that. And I think that's, you know, tit for tat. So that's good. And I think it's difficult as well because predominantly, you know, a lunch hour is, let's say, 1 till 2. That also means that your patient is booked in at 2, but you've got to get your surgery ready as well. So, you know, it's things that are perhaps not seen from patients that, you know, nurses actually, you know, if they start back at 2, that is their start time with the patient. So yeah, it's a tricky one, that one. We could
that's usually when you dread having your root treatments booked is 2 o'clock because it takes so long to set up for.
Yeah. Oh yeah, 100%.
Yeah. Quite often the girls will come in and I'll be like, where have you been? They're like, oh, we've got a root treatment after lunch, so I'm just setting up for that. And yeah, which is nice to see.
Do you know what? What is good though, and you've said with your practice you do this, and it probably does help, is because you rotate. You have nurses that work on reception, then you have the reception go back into surgery, so they're very aware of mindful booking, really. So that probably works well for you, does it?
Yeah, that does help. Absolutely. Yeah. And just things like not booking, you know, root treatments back to back, or, you know, stuff like that, because you need to turn the instruments around. So it definitely has its advantages, having a clinical knowledge, as it were, for working on the desk. 100%. Yeah.
Oh, Yeah, 100%. I suppose in many ways it's got a lot of pros to it, because much like you just said, with the appointment book for the clinicians, you know, they've got a good idea, like you just said, you know, not to put back to back and not to do that. And also the setup time, you know, it might be that they try and get checkups either side of lunch, you know, so, you know, you're not having to nip into your lunch to go and set things up.
Yeah.
But then you see, I mean, the cons of it, or certainly what some of the clinicians I used to work with used to say, is they never had the same nurse for, you know, every day, you know, so they felt that they'd prefer one nurse all the time.
Yeah, we've had this in the past with certain clinicians, especially one guy we had that was very into endo and massively into cross-infection control. And he sort of felt that he was tearing his hair out because because we rotate on a weekly basis. Okay. So he very much felt that he'd get one girl where he wanted it to be in terms of knowing exactly what he wants for his endo. He was very much into four-handed dentistry, that side of things. And then he felt quite deflated when come on a Monday, he'd have someone else. So he'd have to go through the whole rigmarole again of, you know, this is what I want. And because it's a lot to remember. So, you know, obviously things would be missed and then he'd get a bit irate about it, which is, you know, it's understandable if you want to work. I mean, he was very heavily involved in endo. He really was. And that's brilliant. But to train people, I mean, we've got 13 nurses. So if he's having to sort of go through the same, he found it quite difficult. And then the girls found it very intimidating as well, because they knew when they were going in with him that this was something that annoyed him. He wanted just one nurse. So they'd be very sort of on edge, nervous, setting up for him because they wanted everything perfect. And so it's got its cons. It really has.
Do you know what, as well? I mean, I can sympathise with both sides there as well. But you see, what happens then, and my thought was when you had, I totally get it. If you've got one nurse, they know you inside out. I get that. And it's an easier day, or that's what, you know, people would say. It's an easier day for me if I have to say nurse because, you know, blah, blah, blah. However, if that nurse is on annual leave or if that nurse is sick,
100%.
then you're scuppered then anyway. So what we did in the end, because, you know, I totally sympathised with both sides, is we did similar to you. So we did, I think it was like a 2-week rota between a couple of the nurses per dentist. So it meant that both nurses, if you like, that would work with that clinician would know what they're doing. So, you know, there wasn't countless retraining, but it helped because if one was off, hopefully the other was there to pick up the lead. Yeah,
absolutely. That's the main reason we rotate, is because if you do become set in your ways, that we all do. We're all, you know, especially as dental nurses, because most dental nurses are creatures of habit and they like everything so. And also, it's just that side that you get to sort of mix with everybody as well. Sometimes I've worked with people before that can sort of become very cocooned in their surgery, and they might not come and get involved at lunchtime because they're, you know, they're sort of already with who they want to be with, so they don't need to come out and mix with anyone. And it's just nice as a team that everybody knows each other and can work together. So that's what we find is, you know, works best for us.
I mean, it's individual practice, as we've said before. It's whatever works for them. You know, I don't think it's one thing fits
Absolutely
all, but
not.
It certainly does work very well with your practice. I mean, it's seamless with your nursing team, to be fair. So, I mean, it is credit to you guys. Let's just say it's pros and cons.
Absolutely.
And cons.
Yeah.
Shelley, have you seen the time?
I know. We were going to try and keep it to 10 minutes. We're already nearly 5 over, aren't we?
Everybody out there, we're going to do 10 minutes. Yeah, we can do this. We haven't. But we will again. Shelley, I think we're going to stop it there.
Yes.
We've got somebody that's going to join us hopefully next week. If not, it'll be the week after. A familiar face. So
okay, good.
And I speak on behalf of Shelly and I. Please hop on. Tell them, Shelly. Tell them to come and join us.
Come forth and spread the knowledge. Spread the thumbs up for the dental nurses. Yeah.
Absolutely. This is a platform for you guys. So hop on, come and have a giggle with us, and come and tell everybody out there why us nurses keep going back into practice. Come on, fly the flag. Shelly, as always, it's been a pleasure.
And you, lovely. Thank you very much.
No problem at all. Take care.
And you.
Bye, everyone.
Bye. Bye.
Bye.